Okay, I've produced this video to try and help you with your probe positioning to achieve the standard right parasternal echocardiographic views. So your starting point is to have your patient in right lateral recumbency, and basically if you feel for the apex beat, have your thumb on the button and you put your probe onto the chest wall. That's your approximate starting point. And this is the deep scope ultrasound simulator. So we're going to use this to try and demonstrate the probe positioning. This is courtesy of deep scope, and this has been really useful in terms of teaching. So what you can see here is I've got the right parasternal long axis view, and what you're attempting to do is slice the left ventricle and the left atrium in the long axis plane, so that you're optimizing the full length of the left atrium and the left ventricle. So basically you're slicing from the base to the apex of the heart. So what you're attempting to get in this view is the left atrium and the left ventricle and the right atrium and the right ventricle. And you try not to foreshorten the view. So you're trying to get the full length of that, left ventricle in your image. So this is a real ultrasound image. This is my dog Nell, and what you can see here anatomically is the left atrium, the mitral valve, the chordae tendineae. There's a little bit of papillary muscle here, left ventricular free wall, interventricular septum, interatrial septum. Note there's a bit of echo dropout there. That's not an atrial septal defect. The right atrium, the tricuspid valve, the right ventricle, and the right ventricular free wall. So once you've achieved the right parasternal long axis view, what we were looking at there was the long axis inflow view. And what we mean by inflow is we're optimizing the flow from the left atrium through the mitral valve into the left ventricle. So to get the right parasternal long axis outflow view, what we're attempting to do is to change from this view to this view, and the technique is to rotate your probe 10 to 15 degrees anti-clockwise. So it's in the direction of the thumb towards the bum. Thumb towards the bum. Okay, I'll just press play on this video if you have a look. So long axis view, record. Inflow view, and outflow view. So it's a thumb to bum, 10 to 15 degree anti-clockwise rotation. Once again, long axis inflow view and outflow view. And this is what it looks like using the deep scope simulator. So inflow view and rotate, thumb to bum, and you get your outflow view. Inflow view to the outflow view there. And what you can see when you optimize this left ventricular outflow view, what you're optimizing is the left ventricle, the left ventricular outflow tract, the aortic valve, and the aortic outflow, or the main part of the aorta. So again, on a true ultrasound scan, this is what you tend to see. Anatomically wise, you sometimes will see part of the left atrium, the mitral valve, but the main part that you're looking to optimize is the left ventricle, the root of the aorta. Here's the aortic valve here, sinus of Valsalva, and the aortic outflow. So on the moving image, this is blown up a little bit as well with using the zoom button, but as you can see, the usefulness of this view is that you can see the left ventricle, the left ventricular outflow tract, which is all of this, the aortic valve, the sinus of Valsalva, which is this area here, and the main portion of the aorta, the ascending aorta. This is useful, obviously, for looking for example at aortic stenosis, subaortic stenosis, aortic endocarditis, perhaps, or if you're looking for evidence of obstructive cardiomyopathy in a cat, this would be the view that you would be trying to achieve. So on to the next slide. So if we want to then swap from the long axis views to the short axis views, we're going to do another thumb to bum maneuver, but this time it's going to be a 90-degree maneuver in the direction of the dog's bum. Okay, so thumb is going 90 degrees towards the bum. Okay, so this is what it looks like. So long axis view, thumb to bum maneuver to the short axis view. Do that once more. Long axis view to the short axis view. Okay, so this is what it looks like on the deep scope ultrasound simulator. So after we've done the thumb to bum maneuver, as you can see here, what we're doing is we're slicing the heart in a short axis view, so that we can see short axis slices through the heart. If we just play this video now, you'll see what I mean. So what you can see, I've rotated my thumb to bum 90 degrees. The positioning button is headed towards the dog's bum, and what we're doing is we're taking a slice through the left ventricle there at the level of the papillary muscles. So if we then fan through in short axis through the left ventricle, we can then fan through these different slices, A, B, C, D, E, and F. And so we see different levels of the left ventricle and left atrium in a short axis plane. And the technique for fanning through these different short axis views, it's a little bit of both fanning and rotation as you go further dorsally, and essentially you're pointing towards the dog's left shoulder. Left shoulder's up here. So roughly speaking, as you fan through the short axis views, you should be fanning roughly towards the dog's left shoulder. So we'll just play this video now. So we're fanning, rotate, 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 back to the first view. So that was us going through the different slices, A, B, C, D, E, and F. It's fanning and rotation is the technique for that. And so here are the different slices that you'll see. So here's slice A, which is just the apex of the left ventricle. Next slice is at the level of the papillary muscles. So you can see the two papillary muscles in this view here. I'll get the pointer. Here's your two papillary muscles. And the two papillary muscles form a sort of mushroom shape. So we tend to call this the mushroom view. On to the next level, level C. If this will go, doesn't want to go. Next level, next slide. Okay, try that. So at the next level, what we have is the chordae tendineae, and the chordae tendineae tend to form some dots. Now this is an important view because at the level of the chordae tendineae, this is the level where we would normally measure the left ventricle using M mode. So we tend to drop our M mode cursor down the middle of the left ventricle, and that's how we would measure the dimensions, the chamber dimensions in systole and diastole using M mode. So the next view on from there is what we call the fish mouth view. And in the fish mouth view, what you can see here is the anterior and posterior mitral valve leaflets. And this is really useful for evaluating mitral valve disease, myxomatous changes to the mitral valve. And if you've got slow motion, like what we can see here, then slow motion is really useful to allow you to see the movements of the mitral valve. It makes it easier to see myxomatous changes, in my opinion. Here's a slow motion movie here. So this is the fish mouth view. Looks a little bit like a goldfish mouth. And then on to the next level. So level E is the level where we would want to look at the relative sizes of the aorta and the left atrium. So anatomically here, what you can see is the aortic valve, which forms a Mercedes-Benz sign. So we tend to call this the Mercedes-Benz view. This is the left atrium, and the pointy bit at the end is the left auricular appendage. And as I said before, this is really important to be able to get this view and to get it accurately, because what we're looking for is to get a nice view of the aorta and the left atrium, so that we can then take our left atrium to aortic ratio. And what you can see in this blown up view on the left here are the three cusps of the aortic valve leaflet: the right coronary cusp, the left coronary cusp, and the non-coronary cusp. If we go a little bit further dorsally, you will see get my pointer, the aorta in the middle. You can see the pulmonic valve, and these, relatively speaking to each other, should be 1-to-1. So if the pulmonic valve is bigger than the aortic valve, you need to be asking the question why. And if you fan slightly further dorsally from that point, you will then open out the main pulmonary artery and the right and left branches of the main pulmonary artery. So there we are. Hope that helps, just to get your head around the probe positioning for the right parasternal views. Okay, thank you.